The incidence of tuberculosis, or TB, in Papua New Guinea is among the highest in the Western Pacific region. Western Province, Gulf Province, and the capital, Port Moresby, are believed to have the highest number of infections in the country. Following the global trend, only HIV is responsible for more deaths in PNG.
In 2014 we opened a project in the Gulf Province of Papua New Guinea in Karema, where we intend to meet the very specific challenges of that province, which has remote populations who are hard to reach, suffering very high levels of TB. This year we're opening a project in the capital, Port Moresby, in the National Capital District, where we will help the government of Papua New Guinea combat TB in that particular context, which is different again from Karema, but they're suffering even higher levels of TB burden, including serious levels of multi-drug resistance TB.
There are many challenges in tackling TB in Papua New Guinea. There is limited diagnostic capacity. Access to medical services is difficult, especially for the 85% of the population who live in remote and often inhospitable areas. Adherence to treatment is low, and there is the emerging threat of drug-resistant and multi-drug resistant strains developing. But overall, there is simply a low awareness of TB in the population.
The MSF TB program is of course conducted with key partners. Firstly, the Papua New Guinea government, the Ministry of Health and National TB program, but also the Australian government, who devote significant resources to their partnership with PNG to combat TB. And we work with them to help overcome some of the barriers that we see through our operational efforts against TB in PNG. And perhaps at the moment, critically, we need to ensure that PNG, as soon as possible, has a fully functioning laboratory that is able to process TB samples in country, so we can both diagnose the scale of the problem effectively, but also do drug susceptibility testing so that we can understand the full scope of the multi-drug resistant TB problem which is emerging in PNG.